Hi guys, this is Dr. Hesser here and Justin. This is Woodrow. We're going to show you guys how the BAER hearing testing works. And I'm going to do a little demo with Woodrow. So he's going to be our handsome volunteer. So BAER testing is brainstem auditory evoked response. Basically what that means is it's the measurement of the ability of the dog to hear by using their neurologic system as a test. So we attach some leads and create a stimulus that gives a sound, and then they should respond on a little machine that we have and show us peaks and waves and things like that that show that they can hear. So it's a good thing for certain breeds. I would say Border Collies are among the ones we do most frequently. The most common poster child would be Dalmatians that have some hearing issues, but there's lots of breeds with congenital deafness that we do lots of litter checks on. So we can also do this in dogs that are adult and in dogs that are under anesthesia even will respond to the test. So we're going to start attaching the leads here. So Justin's going to help hold Woodrow. This is actually Justin's puppy Woodrow here for our exam. He has not had any testing done before, so this will be a good example of how a puppy might react. Some of them are really tolerant and others need a little bit of time. We use acupuncture needles to basically place the leads, so the leads will attach to those needles. And then once we have everything placed, then we hook up all the wires and make sure everything's working okay, and then we record the test. All right, Woodrow, I know. So there's 3 places for our particular unit, there's 3 places that they want you to put the leads. So one is right here on the top of their head, and then right underneath the ear on either side. So the leads all coordinate with a specific place. So the black lead goes on top. Hey buddy, good baby, good boy. Sometimes these puppies are really good for sitting still, and sometimes they get a little impatient, so we'll see. Hi, buddy. We'll see how he does. He's a pretty good boy, so I figure he'd be a good first-timer here. All right. I'd say the hardest job sometimes is just getting these leads placed. If you have any breeds with coat, sometimes it takes a little bit of time to kind of get things situated. Good. So some puppies will use baby food, so frozen baby food can keep them preoccupied. It's actually the same technique that we use in acupuncture. I stole it from Dr. Huckabee. It seems to work pretty well. All right, so he's all hooked up now. So all we have to do is put the earpiece in. That's gonna, I know honey, I know, good boy. Good boy. So we're just going to put the earpiece in. So this is on the left side. So I've got a little switch here. I'm going to turn it to the left. And then we're going to start collecting data. So there's a little sound that he hears, and you probably saw him move a little bit. So he definitely can hear on that side just from noticing that response. But we're also going to get a little wave measurement just to show. Good boy. Good boy, buddy. So usually we collect a period of waves, so each time this new click sound starts, it'll record data over and over and over. It kind of overlays that, and then we're able to save that. And then that's what we use to submit for hearing testing paperwork. If you guys have need for OFA submission for hearing testing, that's basically how we do it. So that's the left side. So we're going to do the same thing on the right side. I know, Cooper, good boy. He's being very good. Good boy. I know. You're going to be naughty now that I said that, huh? So he can hear on both sides. So both sides have shown nice waveforms and nice stimulus. And so I would say he can hear 100%. So he would be a good candidate for a breeding program if he turns out to be a good dog otherwise for the criteria that they're interested in. So that's pretty much the whole test. So after we get done, we'll usually take 2 samples, but for his purposes, we'll just go ahead and take his leads out. Since he's just a demo dog, he doesn't need 2 checks right now. So we'll go ahead and take out these little guys. Hide our little needles in our blanket here. Remove all of our leads. And then he is good to go. Thank you guys for watching. This has been BAER Testing 101. Thank you to Justin and for bringing Woodrow in for us to use as a tester dog, and we look forward to seeing you guys in the clinic. If you have any questions, please let us know. We'd be happy to answer.